Fellowship of the Great Physician welcomes you to House Call. Our hosts today are chiropractic physicians, Dr. Gerald Lala and Dr. Richard Jensen practice in Roseville, Minnesota, and Dr. David Schwittert in Rapid City, South Dakota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Hi everybody, I'm Dr. Jerry Lala.
I'm Dr. David Schwittert.
And I'm Dr. Richard Jensen.
It's great to be with you. Thank you for inviting us into your home, or hospital room, or place of work, or wherever you might be. And we are chiropractic physicians, and we're brought to you by the Fellowship of the Great Physician. And of course, we believe that Jesus is the great physician, and we don't see Jesus as a denomination, although I'm sure he's in denominations and non-denominations. We just see him as our Lord and Savior. But what we're going to do today is focus on what are called TBIs, or traumatic brain injuries. And Dr. David Schwittert is chairman of our Department of Traumatic Brain Injuries and Neuro-Emotional Treatments. And so, Dr. Schwittert, how about if you give a good discussion of what traumatic brain injuries are and the kind of situations that people are in and how they can be helped?
You bet, and I'd be pleased to do that. The National Head Injury Foundation defines traumatic brain injury as an insult to the brain that may produce a diminished or altered state of consciousness, which results in impairment of cognitive abilities, behavior and emotional dysfunction, speech impairment, and physical disabilities. Well, it can be said that there's a lot of things that are related with TBI, and a lot of times you think of trauma or outside influences, but there can be biochemical, as we're going to learn a little bit later. There's other forms of TBI, so we're going to use that broad-based definition to include a lot of different things. It could be said that most, if not all, head injury survivors will be the last to recognize or admit that they've suffered a head injury or TBI. And because a survivor's personality has changed, the immediate family is usually the first to recognize what's happened, which then leads to interpersonal conflict and discourse, because the TBI survivor thinks there's nothing wrong with him or her, it's everybody else that's the problem. Symptoms often don't show up immediately following an accident, but may persist indefinitely. And because symptoms can be subtle, we're going to be talking about some of the things that can help in recognizing a head injury or TBI, if it's occurred or not. Now I'm going to give it to Dr. Jensen. He's going to tell us a little bit about what can happen with decreased physical abilities. Dr. Jensen.
Thank you, Dr. Schwittert. Well, some of the things that one might experience with this is fatigue, loss of balance, impaired vision and dizziness, loss of sex drive, sleep disturbances, difficulty speaking clearly, sensitivity to light, sound, or touch, lack of endurance or strength, problems with walking coordination, use of limbs, problems with sensation, loss or impairment of bowel or bladder control, and continued health problems such as seizures. Some other things, let's go to Dr. Jerry Lala.
And thank you, Dr. Jensen. Some of the changes in behavior and emotional control of people who have had traumatic brain injuries, including spinal cord injuries. You can't injure the brain without having ramifications on the spinal cord, and you can't have injuries to the spinal cord without having negative ramifications on the brain. But some of those emotional and behavioral changes are irritability, anxiety, depression, withdrawal, changes in control of temper, impulsivity, lack of energy, poor or changed social interaction, strained family relationships, fits of anger, aggression, verbal outbursts, fear of the future, problems in controlling behavior, especially in social situations. Now, Dr. Schwittert is going to look at what are some of the decreased cognitive abilities that often occur in people who have had traumatic brain or spinal cord injuries.
Thank you, Dr. Lala. Problems are going to occur with attention, concentration, and memory, problems with basic academics such as multiplication, dividing, difficulties handling money, difficulties beginning or following through on tasks, inability to clearly reason or to solve problems, slowing down or slower thought processes, inability to say what is meant, difficulty understanding others, trouble following instructions or directions, inability to manage time, poor insight into problems that are occurring. Head injury, or TBI, is a relatively new name that can encompass a broad range of severity deficits and outcomes. Head injuries can either be open or closed. With a closed head injury, many physical, behavioral, and cognitive changes can occur. So let's talk about some of the factors that can contribute to TBI. Well, of course, the most obvious is physical. Physical such as blows to the head, those that might be received in a motor vehicle accident, workers' injuries, sports injuries, falls, gunshot wounds, assaults of all kinds, motorcycles, tricycles, and bikes. Those would be some of the ones that could be physical. But they could also be vascular. Remember, we talked about TBI encompassing, that general term encompassing other things, such as disease processes like tumors, illnesses, strokes can cause TBI, medications and congenital factors can be involved. Well, it's often said that a person who has had a TBI, even though they haven't lost consciousness, can still sustain a brain injury. Minor brain trauma, where there is little or no loss of consciousness and no resulting hospitalization, can also cause temporary and or permanent damage to the brain. After the initial injury, which is often dealt with in emergency rooms or ICUs, comes that long and difficult road to recovery and rehabilitation. Brain injuries, get this now, pay attention, brain injuries affect families, not just the injured alone. Unlike many other forms of injury that can occur, we find that there's little information readily available to a survivor's family. For instance, if somebody's had a head injury and they get out of the ICU or they get out of the doctor's office, they told them that those things will go away, the headache will go away, and all these deficits start to creep up, they don't know where to go. So there's a lot of people out there that are having problems that don't know that they've had a traumatic brain injury, and they're suffering from it and nobody knows what's going on. Often even the medical specialists are lacking in the scope and understanding of TBI, its ramifications, both as well as short-term and long-term outcome. What we're talking about today is not meant to be a definitive resource or source. It's meant to bring and shed light onto this wide scope of therapies that can help the TBI survivor and their families and loved ones in regaining and restoring their lives. And I think that's the neatest thing that we can share with you. If you could just get one thing out of this program, know this: if you're a TBI survivor, or if you've had somebody, a loved one or a friend that you know, tell them that there's hope. There is hope, because nobody's telling them that there's answers to what their problems are. So you can light the candle and you can spread the light in their lives. And I don't care if it's been 5 years or 10 years or 15 years or whatever, post-accident, there is hope. The full impact that TBI brings to the table affects, as we said before, not only the patient, but their family as well. Basically, we can talk about TBI being subdivided into 3 types of categories: the mild, the moderate, and severe. Most of what we're going to be talking about today will affect and be specific to the mild and moderate, although some of it would blend over into the severe. Though much of what we will discuss may apply to that severe injury, our focus is going to be centered on those first 2. For ease of understanding, it's going to be easier to understand the 3 phases that people go through after a TBI injury, and we're going to call them acute, rehabilitative, and maintenance. So Dr. Jensen's going to bring us through, talk about the acute TBI.
Thank you, Dr. Sweetert. The acute phase of traumatic brain injury, assuming trauma or stroke, the modern medicine's approach is usually to save one's life. Often the patient is unconscious, comatose, or otherwise disconnected from the conscious world. Many times, TBI, if not initially diagnosed, can be missed because of other immediate life-threatening factors. Recovery is often measured in weeks, months, or years. It's often slow and gets slower with time. Once out of danger, and/or the intensive care unit, the challenge of what you do next becomes very complicated. Unfortunately, there are many ways to go, some good, some not so good. What appears to be lacking is someone with overview capabilities to help you sort through the multitude of options. Remember, everyone you encounter along the way has a vested interest in what they tell you and what they want you to do. What can be confusing are all the good-intentioned people who know a little. The best way to stay ahead of the curve is to be informed. Ask questions. Ask some more questions. And then ask again. Don't quit until you get the answers you seek. Dr. Lala?
And certainly as chiropractic physicians, we see so many of these traumatic brain injured victims, and many times after medicine and traditional orthodox medical care is given up, and then we still see people make progress, and that's why we're doing programs like this. Well, the rehabilitative phase, after the initial acute phase, complications have stabilized. It would then be advantageous to have a neuropsychological exam and evaluation done. Doing so would be early as possible and be beneficial, since different areas of or locations of the brain perform specific functions. Early identification, of course, is important so that a target rehabilitation plan can be begun. A startling observation is that the average time from accident to the initial TBI rehabilitation is 10 to 15 years post-accident. That is incredible. And that's our experience in our clinic. New research is showing that greater recovery is possible the earlier the treatment is begun. Now, in Western society, there are two main approaches that are basically presented. Number one is physical rehabilitation and work rehabilitation. Physical rehabilitation certainly can involve a myriad of therapies: physical, speech, occupational, cognitive, chiropractic, and cranial. Workforce rehabilitation often focuses on returning the survivor to some form of gainful employment, and there's certainly nothing wrong with that. But many times state agencies are available to assist in this matter, but you have to kind of get out there and do some digging yourself to find them. Some states coordinate both types of rehab together, but many do not. It can be difficult getting the right answers, but because state agencies have limited funds and restrictions on the expenditure, again, having outside help, such as persons like Dr. Sweetert or Dr. Jensen, who are really involved in these matters, helping you walk through the maze of recovery is not only helpful but even necessary. Now, Dr. Sweetert, who had a brain injury several years ago, and this is something that's been on his heart, he's going to talk about the maintenance phase. Dr. Sweetert?
Thank you, Dr. Law. Yes, it's true. A number of years ago, I personally suffered a mild traumatic brain injury in a motorcycle accident. I had a son who was a junior in high school at the time, 16 years old, and he suffered a moderate traumatic brain injury, hematomas on the brain and multiple skull fractures. And so I'm fairly aware of what is out there and what works, and at least in my opinion, what doesn't work. As we look at the last phase, the maintenance phase, we can say that it'll continue throughout a survivor's life. It has changed me. Every person that has a TBI, they are a different person than they were before the accident. Specific therapy may change from time to time based on one's progress and changing circumstances. Many times, recovery will be incomplete in returning a person to a pre-injury status. And that's where a lot of the conflict starts, is because the TBI patient, of course, doesn't recognize or realize that there's anything wrong with him. If there's a problem, it's everybody else. But what will happen is that everybody wants that person, if it's a father or a mother or whatever, they want them to be who they were before the accident. And unfortunately, I'm telling you a reality, those people are gone. They're just as well as they're dead and buried in the ground. Those people do not exist anymore. Yes, they have the same body. It might be a little bit different form, but that personality has changed, and their likes and dislikes are going to be different. Their foods that they like, everything about them. Some of it, depending on the degree and where the injury is going to occur, is going to be different. Often the TBI survivor will need to continue care for the rest of their life. Is that a bad thing? No. Does that mean that they're disabled? No. Does that mean that they're crippled? No. Just as if you have a car that has gasoline, the farther you drive it, you got to put gas back in it. Everybody eats food every day. Everybody eliminates waste products. Is that a crutch? Is that a problem? No. What I'm saying is that it's just the way it is. And so those people are going to need support in the appropriate way that they need. Often the TBI survivor will need continuing care for the rest of their life. Of course, the mild traumatic brain injury person who survives is not going to need as much as somebody who's severe. Obviously, if they're in bed and they're comatose, or if they're catatonic, or they're intubated, or they're fed with through tubes, that's going to be a different story. Understanding the whole circumstances leading up to the TBI is the key to setting the proper path. Incorporating multiple approaches will ensure the greatest chance for a successful outcome. Well, why is that important? Because a lot of times how that person suffered a TBI will tell us a lot of who that person is. For instance, just as an example, I'm not picking on anybody, but let's say that there was the person was driving a car, they were inebriated, they were intoxicated, and they had a brain injury as a result of crashing their car into a bridge abutment. And it'd be interesting and important to know, well, okay, they were inebriated, they were drunk. Did they drink before? Yeah, they had a chronic history, or maybe it was an acute episode. Why were they drinking? Well, what if they were having marital problems in their marriage, and that the person who got in that accident was trying to hide or bury the symptoms, the pain, they weren't dealing with it, and this is their way of shutting down the pain in their body? Well, are those marriage problems going to go away after the TBI? No. Those problems are still going to be there. So it's really important to know what that whole picture is, and it's going to take some time to develop that, and that's what we're talking about in that whole person outlook. Now Dr. Lala is going to give us some more ideas.
Many of the people that we see with TBI, as well as spinal cord injuries, look fine. They don't have any paralysis. They walk normal, and many others that we see are in wheelchairs, or they're on walkers. They need assistance. Some of the people are able to take care of themselves, and others need caretakers. And so, but very often people will say, and it's a terrible thing, they'll say, you look fine, you don't look sick. Oh, that happens to me all the time. That's just part of getting older. And they pull yourself together, you know. Pull up your bootstraps, you know, grow up, you know, and say tough love. Well, these people, certainly they need to improve, but they cannot improve because, or significantly because, they've had these brain injuries as well as spinal cord injuries. And we're not talking about the kind of typical routine chiropractic patient that, you know, has a sprain or a strain, but we're talking many people in automobile accidents or workers' comp injuries or other types of accidents, falls. You can't believe the number of people that have falls and have brain injuries. But now, as chiropractic physicians, we're not pushing the chiropractic approach, but there are many different approaches in chiropractic. There's regular chiropractic, that's spinal manipulation and exercise. Another method that some chiropractors use is called sacral occipital technique. Another is adjusting these cranial bones, which are semi-movable. They can be adjusted. You get a head injury, and these bones can go out slightly out of alignment. Another is Dr. Sweetert runs that division in our clinic. He's the chairman of that division. Is neuroemotional therapy, of which he's going to spend more time talking about in a few minutes. Another approach is like what Dr. Jensen is chairman of the Department of Acupuncture and Meridian Therapy, so he gets his hands involved in that, and the neuropsychological assessment as well as cognitive rehabilitation. Now there's another physical part or a biochemical part that needs to be looked at, and Dr. Jensen is going to discuss that.
Thank you, Dr. Lala. When appropriate, other diagnostic tests can play an important role in treatment and monitoring head injury patients. These include a complete orthopedic, neurological, physical examination. These people also, I mean, just because you have a head injury doesn't mean that the rest of you was not in the accident. Also, there are different ramifications that can occur due to upper motor neuron injuries, which are basically injuries to the brain and the spinal cord. So we want to be able to monitor those. X-rays, very important. Check for fractures and other misalignments that can take place within the body. Hair, mineral, and toxic metal analysis. These things can change your behaviors and there can be a physical or a biochemical reason for some of the changes that occur. It's nice to take those things out of the picture as well in your recovery. Whole blood cell elements, these check the minerals as they are within the red blood cells. Those things that are particularly concentrated within the red blood cells, and they show us what has been absorbed into the body, not just excreted through a biopsy of hair. But they're used in different portions. Hair mineral analysis is generally used for long-term to show what exposure has been in the long-term past, whereas a blood cell test, whole blood cell and red blood cell elements tests show what has occurred over, say, approximately the last 120 days. So that would be more of a short-term or an ongoing exposure to toxic metals or what have you. 24-hour comprehensive hormone analysis. We find many times in brain injuries that there are changes in the hormones that have taken place. Many times you look at a brain injury and you say, hey, that's nerves that have gone through this. Well, your nervous system, your brain regulates the hormones and how they're released as well. So we need to check that out as well to see what's going on in there, what is being changed. Hormones also change who you are as well. I talk to my 8-year-old son and tell him sometime in the future you'll start to begin to like girls. And he says, never happened. Never happened. Well, when testosterone gets a grip of him, he's going to start liking girls. Comprehensive blood serum analysis. These things go through the different elements, different parts of your body. We're checking the lungs, the liver, the kidneys, different systems as it goes on, your blood, and what goes on with that. Macro and microcytic urinalysis. What are you excreting? What elements are you losing? Many times when people have head trauma, they have tremors and they're on different types of anti-spasm medications. What kind of minerals are being leached due to that? History and symptomatic evaluation. Very important in a diagnosis and seeing where we have been and where we are going. Post-trauma accident nutritional support. Give them the support for the body to help in healing themselves. Psychological and emotional evaluation. I think that's important, and we're going to hear more about that from Dr. Sweetert.
Thank you, Dr. Jensen. One of the most exciting breakthroughs involves neuroemotional therapy. Often people who have had head trauma continue to experience emotional disruptions that cannot be clearly identified or that block progress. They hit a plateau, they're stuck there. Talk therapy just doesn't seem to take away the pain and the damage suffered. NET, neuroemotional therapy, can often make the difference between success and failure, and I've seen it time and time again. It is just huge. Because human beings are basically emotionally based. There are also other forms of being based. There's the biochemical, the biophysical, the biospiritual, but we're talking in head trauma, emotions play a huge role. Through understanding that there can be a difference between true reality and emotional reality, one can quickly move toward identifying the root causes that have led to one's present circumstances. Said another way, if your body has an emotional reality that believes that it's true, then it's true whether it happened or not. This breakthrough technology allows patients to deal with their emotional baggage which accompanies head trauma. Things like low self-esteem, grief, paralyzed will, fear, resentment, anger, feeling lost, vulnerable, and other emotions. When utilized, neuroemotional therapy is a breakthrough technique that can be a major part of healing and restoration. And I personally believe that it's a major missing link that can not only help the survivor, but also the family of the survivor. This is so because TBI and head injuries reach far into the immediate and extended family. It can be realistically said that the person who has had a head trauma or head injury is not the same person they were before that head injury. In almost all instances, the head trauma patient doesn't realize that anything is different. "There's nothing wrong with me," is often heard by them, is often said by them. If anything is different or wrong, it's most often blamed on others, taking no responsibility onto themselves. Head injury patients now have new likes and dislikes, personalities, and mannerisms, all of which can put additional stress on interpersonal relationships. Unlike the survivor, the spouse and family haven't changed. Most of the time, they want that old person back. Rare is the marriage that not only survives, but thrives and continues to grow. Neuroemotional therapy treatment has proven effective in helping loved ones and family of TBI survivors deal with the cataclysmic changes that usually occur. In summary, we could say addressing TBI and head injury patients takes a multidisciplined approach to present the greatest likelihood of success. It involves the patient, the family, and loved ones' participation. Progress doesn't come easily or quickly. Patience, understanding, and knowledge go a long way when dealing with this multifaceted challenge. And might we say, there is hope. As I go around to various states and talk with various people and organizations in leading support groups for TBI, our knowledge and our expansion of this work is greater every day. But it's really interesting if you will look for more information and links that'll be additional help. You can go to our website, www.vitaminpantry.com, and you can look in under head injury and head trauma, and it'll give you some more information. Now I think Dr. Alala has some closing thoughts.
How can we have closing thoughts? I think they would be probably opening thoughts. There are so many people who have been involved in head injuries, and thank God that we have some of the world's best acute care. Saves these people's lives. Some of them end up with paralysis. Some of them are in pretty bad shape physically and mentally, and it's a whole radical change for them as well as their family and loved ones. And of course, who of us has perfect relationships? You know, we're human beings. We all fall short of God's glory, and so where there are weaknesses in those relationships preceding an injury, those are aggravated. And when Dr. Sweetert was in when that truck hit he and his son on their motorcycle, and they air vacuumed him to Cheyenne, Wyoming, and then stabilized him there, and then air vacuumed him over to Rapid City Regional Hospital, and he was there and comatose. I mean, he was a goner. And he has a wonderful testimony about what the Lord has done in his life. And some people say, well, why are you guys Jesus freaks? Well, we're not Jesus freaks. We just happen to reach out and utilize anything and everything that we can that has any halfway sense to it. And if you've had some kind of an injury, God didn't cause that injury. God doesn't do bad things. He came, if he was bad oriented, he would have never sent his son. He would have never done that. And so God loves you. He cares for you. His son is the great physician. Maybe you've reached out to God and not had an answer. Maybe you've reached out to God in a religion rather than a spiritual dimension. I don't know. Those are all things between you and your Maker. But we find that there are dimensions beyond where orthodox medicine has stopped. And we praise the Lord for the drugs that they have and all of the physical therapy things they have. But there are other techniques, such as that Dr. Sweetert spoke about with neuroemotional therapy, not being used by organized medicine, but a wonderful approach, as well as a biochemical approach and acupuncture that Dr. Jensen talked about. So there are things. You cannot get well if your internal biochemistry is not functioning normally, and you're not going to fix it by throwing some vitamins and minerals into your body. You got to find out what you really do need and what your body doesn't need, and you look for it. You keep knocking on the door and you find some answers.
Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening from 6:45 to 8:30 at North Heights Lutheran Church in Roseville, Minnesota. There is no charge or registration fee for these classes, but free will offerings are received. The major emphasis of these classes is on biblically based spiritual health and healing, with a brief teaching on physical health and healing. For further information on the School of Health and Healing or the topics discussed on today's program, visit our website at www.greatphysician.com or contact the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 2353 Rice Street, Suite 210, Roseville, Minnesota 55113. Telephone 651-484-8521, or in care of Dr. Schwietert at 3936 Jackson Boulevard, Rapid City, South Dakota 57702. Telephone 605-342-3861.